Thank you. Hello. So I think one or two people of you here might recognise me, but most probably won't. So I'm Ben Rhodes. I'm a rheumatology consultant at the Queen Elizabeth Hospital, Birmingham, and I was going to talk to you today a bit about lupus and the kidney. And you sort of may wonder why I'm qualified to talk to you about this. So at the Queen Elizabeth Hospital, we run weekly multidisciplinary kidney clinics, specifically to look after patients whose lupus has affected their kidneys. I run that with a nephrology colleague, Pete Hewins, supported by Sarah Logan, who's going to talk to you after this. And we look after about 150 patients at the moment who have lupus that's affected their kidney, ranging from people who are diagnosed a couple of weeks ago to people who've had the diagnosis and lived with it for at least 10 years. So what I'm going to do today is just talk a little bit about what the kidneys do, a bit of an introduction, talk about who might get lupus affecting the kidneys and how you know that it's affected your kidneys, and what your doctor should be doing to make sure that it's not affecting your kidneys. And then talk a little bit about the pathway that you might expect to go through if it turns out that the lupus has affected your kidneys and what you would expect to happen. And then, depending on how much time I've got left at the end, I'll talk a little bit about the people who have more complicated kidney disease, where there's actually some damage resulting from the lupus. I think it's difficult to come along and give a talk about potentially a very serious disease manifestation, because I certainly don't want to sort of spread anxiety and panic. And I think that the sort of key message from this is that lupus that's affected your kidneys is a very treatable condition now. But the key thing is that it has to be identified early, and it has to be treated adequately and reasonably quickly and vigilantly. And if there's one sort of take-home message from today, it's that, and that's what I'll keep banging on about. So I'm sure you all know roughly what a kidney looks like. We've got two of them. They sit at the top of your back up there, and they make urine, and that's basically what they do. So the reason that they make urine and what that urine's for is that the kidney performs a number of functions. So it regulates how much water there is in our body. It regulates the sort of concentration of salts and different chemicals within the blood. It has an important role in eliminating some toxins. So most of these toxins are things that your body naturally makes just as part of being a living thing. But obviously it can eliminate some toxins that you eat in your diet, and it can eliminate some drugs that we give you to treat your disease. So as a consequence of regulating how much water and salt there is in our body, it also plays an important role in keeping our blood pressure just right. And then our kidney also performs some other sort of slightly more unusual functions which you might not immediately have thought of. So the kidney makes a hormone called erythropoietin that stimulates our bone marrow to make red blood cells. So our kidney is important in ensuring that our blood is healthy. And our kidneys also play an important role in regulating how vitamin D works within the body. So your kidneys are also important in keeping your bones healthy and ensuring that our calcium levels and the amount of calcium in our body is well controlled. But the sort of key role of the kidney is obviously this business of making urine and controlling the water and salt levels in our body and eliminating toxins. So our kidney is a very efficient sort of purification plant for the blood, and it has a very high blood supply, so that it can perform this function very efficiently. So the sort of dirty blood, if you want to call it like that, goes in through the renal artery. The blood supply sort of spreads out to get to all parts of the kidneys. These kidney cells clean it and return it to the circulation via your renal vein. And the sort of cleaning process is a two-stage process. So the first part of the cleaning process takes part in this sort of specialised thing called the glomerulus. And if you go to a kidney clinic, you'll hear people talking about glomerulonephritis, which is sort of inflammation of the glomerulus. So the glomerulus is basically, it's like a sieve. So the blood vessels that are all knotted up in this glomerulus are rather leaky, so they allow the water and the salts within your blood to leak out of the circulation, but they hold the cells and the protein, which is quite a large molecule, within the circulation. It doesn't allow that to escape normally. So what's filtered through then sort of enters this sort of complex network of tubules, and within those tubules your body reabsorbs just about the right amount of water and just about the right amount of salts to keep everything stable and as it should be, and then what's not needed to be reabsorbed then passes out in the urine. So this is a two-stage process. You filter the blood and then you reabsorb the stuff you need, and everything that's not needed passes out in your urine. So the bit of your kidney that tends to get involved in lupus is this bit called the glomerulus. So just hold that in your mind for the sort of next bit of the talk. So we like ancient Greek and Latin in medicine. So ancient Greek for the kidney is nephros. We tend to add the suffix itis to indicate inflammation, and you end up with nephritis or inflammation of the kidney. So inflammation of the kidney in the lupus we also tend to commonly refer to as lupus nephritis. And probably somewhere between 40 and 50%, so just under half of people who have systemic lupus will have lupus nephritis as part of their condition. Like so many parts of lupus, it's very difficult to give you certainties. I know you have to be sort of get used to living with a lot of uncertainty. So one of the uncertain things in lupus is trying to predict who is going to get nephritis and who isn't. And we can see some general trends, but in general I think we have to accept that most people with systemic lupus have some risk or other of getting nephritis, and we have to look for it carefully. But I think it's definitely true to say that nephritis is much more common if you develop systemic lupus either as a child or as a teenager, and becomes rather less common as you develop lupus later in life. And I think in common with lupus in general, I think if you come from a non-European ethnic background, your risk of getting nephritis is probably slightly higher as well. But these are just general trends, and we have seen people with lupus nephritis of all ages and all ethnic backgrounds. I think that this is a reasonably safe and strong statement to make, which is that most people who get lupus nephritis get it pretty early on in the course of their lupus. So I had a quick look at our sort of data from our clinics this morning before I came here, and I think that so well over 90% of patients we see with lupus nephritis have developed nephritis right at the beginning when they first start to get unwell, and a very smaller number of people develop it after having had lupus for quite a long period of time. And we've had some people who've developed nephritis, sort of 10 years after their systemic lupus was developed. But I think if you have lupus in the audience and you've had it for 20, 25 years and your disease is generally stable, I think you need to be much less worried about getting nephritis compared with if you've had lupus for a year and that was it. But no certainties. So the important question is, how do you know that you've got lupus nephritis? And the answer is that you don't really know that you've got it unless your nephritis is very advanced. So you might think that's nice, you're used to putting up with a lot having lupus, so it's quite nice to have a manifestation of lupus that doesn't really make you feel unwell, or you don't know about it. But of course, it's important to know about it, because if it goes untreated, it can have consequences. So to add to the problem is that usually your blood tests are also normal when you first get lupus nephritis. So your kidney function, the sort of things we measure in your blood that indicate whether the kidney is eliminating toxins, don't get affected to start off with. So your blood test's normal, you don't feel anything, you certainly don't get any pain or anything like that. So the only way we really know that you've got lupus nephritis is by testing your urine. And your lupus doctors should definitely be checking your urine when you go to see them, and if they're not, you should probably ask them why they're not. And I know it's a bit of a pain coming to clinic and trying to get some urine in these little pots, but it is really, really important that we see that. So this is a sort of a blown up picture of that glomerulus that you saw at the beginning. So this is the sort of the filter bit of the kidney. So the blood comes in and it circulates around this sort of network of blood vessels, and the sort of initial part of the urine passes out. So when this starts to get inflamed, the first thing that tends to happen is that the filter doesn't work quite so well. So this glomerulus becomes rather leaky, and it starts to let protein and blood cells, red blood cells, pass out into the urine when it shouldn't normally do it. So we look for the first signs of lupus nephritis by detecting blood and protein in your urine. So you've got a bit of blood and protein in your urine, but you don't feel unwell. So why does that really matter? Well, a number of different things can happen if you have lupus nephritis. So one possibility is that the amount of protein that leaks into your urine starts to become extremely high and actually lowers the amount of protein that you have in your blood and your body. And this has a number of consequences, and we give that a name. So this is nephrotic syndrome. So people who have nephrotic syndrome tend to retain a lot of fluid in the body, get very swollen ankles, swollen thighs, fluid in the lungs. And the leakage of important proteins into the urine also has a number of other consequences, and in particular it dramatically increases your risk of having blood clots, puts your cholesterol levels up and so on. But initially your kidney function is normal. So the second possibility is that the inflammation in this glomerulus is so active that it actually stops the filtering function altogether, and your kidney becomes unable to eliminate toxins. And so this leads to the development of kidney failure. I have to say, sorry, I keep pushing that backwards and forwards button, don't I? So I have to say that developing kidney failure from acute lupus nephritis is now exceptionally rare in the UK. We don't see this very much at all. Traditionally, in the 1940s and 1950s, this was a key reason why people with lupus died or became extremely unwell. But we don't often see this. What's much more common is that the inflammation in the kidneys, if it's unchecked, leads to scarring in the kidney. And the scarring, over time, reduces the ability of the kidney to work properly. And so you develop a very slow and progressive impairment of kidney function. And of course, scarring, just like if you've got a scar on your skin, that is an irreversible process. So as much as we'd like to be able to reverse and put scarring back to normal, we can't. Once you've got it, you have to live with it. So we really feel that this is the most important reason why it's important to detect lupus nephritis early. So the longer you have inflammation that you don't know about, and the longer it goes on without being treated, the more the chance of it doing irreversible damage to your kidney is. And the only way you know whether you've got inflammation in your kidney is by having regular urine checks. Okay, so you go along to your rheumatologist or GP or other doctor, and your urine gets tested, hopefully, and you're told that there are some abnormalities in it. So what we're really interested in with lupus nephritis is the protein in particular. So you don't really get lupus nephritis without any protein in your urine. So you may get some blood as well, or you may not get blood. If you've got blood on its own without protein, that's not likely to be lupus nephritis, but indicates bleeding from your bladder or some of the tubes that the urine passed through, and that needs a different set of investigations. It's quite common to find there are some white blood cells in the urine. You quite often see that on the dipsticks, and we need to think about infection causing white cells. But I think we very, very commonly see this. Sort of a low number of white cells seems to occur in at least half of the patients we get in clinic who test their urine, and it probably isn't very significant or anything very much to worry about. So if you have blood or protein in the urine, you know, there are some very simple things that can be done. I mean, it's important just to make sure it's not something as simple as a urine infection. And I think that it's important that the urine is sent to a laboratory that can do some more accurate and detailed tests of urine. So the dipsticks the doctors use aren't particularly accurate at telling you how much protein there is. So we send a sample off to the lab, and we either, depends which hospital you're in, it doesn't really matter too much, do an albumin creatinine ratio or a protein creatinine ratio, and that tells you how much urine there is, how much protein there really is in your kidney. And if there's a reasonable amount of it, and we can't come up with another explanation, and it's there over a few weeks, we've seriously got to think that you may have lupus nephritis. And so and at that stage, I think it does start to become important that you see a doctor who has some sort of expertise or background in managing people with lupus who affects the kidneys. And if you're not, you maybe should ask to see someone who has that expertise. I think that what we're increasingly realising is that at the early stages of identifying evidence in the urine that suggests lupus nephritis, we should really be performing a renal biopsy. Now, renal biopsy is maybe not quite as bad as it sounds. It's something that's done as a day case procedure. It's done under local anaesthetic, and using an ultrasound scanner, the doctor will pass a small needle into your kidney to take a sample of the kidney tissue that can then be looked at under the microscope. And the importance of this is that, first of all, it makes or confirms the diagnosis. The appearances of lupus nephritis on a kidney biopsy are very distinctive, so we can say for certain that you've got lupus nephritis and that you haven't got some other coincidental kidney disease that may require a different sort of treatment. And it also enables us to look at how active the kidney disease is, because there are some forms of lupus nephritis that generally don't progress and cause a lot of problems and may not need a dramatic increase of treatment. But on the other hand, there are forms of lupus nephritis that we definitely know need some pretty strong treatment to get on top of, and that giving that treatment is important because it prevents this long-term damage to the kidney. If you've had nephritis yourself and had a biopsy, you'll probably be aware that we can sort of give you a sort of classification system of lupus nephritis. You can talk about class 1, 2, 3, 4, 5 and 6 lupus nephritis. And I think the key thing to realise is that that's not like a severity scale. It's not that 6 is better than, or is worse than 5, is worse than 4, is worse than 3. So these numbers refer to whereabouts in the glomerulus the inflammation primarily seems to be. But the honest answer is that your class 3, 4 and 5 nephritis all gets treated roughly in the same way. Class 1 is very mild and probably doesn't need any treatment. Class 2 probably doesn't need treatment over and above how the lupus is affecting the rest of your body anyway, and a class 6 is actually not something that you would see on a biopsy if you just developed nephritis, so that's someone who has a very advanced scarring to the kidney. But if you get that number, it's not like a severity scale, it means something slightly different. So if you get the diagnosis of lupus nephritis from your biopsy, I think the first thing to do is not to panic. if you go onto the internet, I'm sure you can see all sorts of bad things about lupus nephritis, but this is a condition that we feel that we can offer very good treatments for. But I think we have to be realistic and say that you're probably going to end up taking quite a few more tablets than you were used to doing previously, because we have to control this inflammation, but we also have to look after a lot of other things that may help protect your kidneys in the future. I think we have to be honest and say that you may have to expect to have rather more blood tests and hospital visits than you were used to initially, and that's often difficult, especially if you've got a young family or you're working or you're studying. And I think if you can try and get yourself booked into one of the specialist clinics, either with us or at Caroline or some of the other units around the country, we will be able to support you through this sort of difficult time and all of these tests and tablets. And it's important that you do get that support. So I've lost track of it when I started as well, do you? About 5 minutes. Okay. So what do we do if you've got nephritis? Well, we need to stop the inflammation. Actually, a lot of what we do in lupus is based on sort of expert opinion, but when you drill down and look at the firm evidence from scientific studies about what the best thing to do is, it's rather difficult to find. Lupus nephritis, I think we're quite lucky, so although it's a very potentially severe manifestation of lupus, we actually have quite a lot of good evidence about what the best things to treat this is. And in general, our first choice treatment would be a tablet treatment called mycophenolate, combined with initially a fairly high dose of steroids that we would aim to cut back gradually over a period of a year to 18 months. Now, there is some interest or thought that we may be able to avoid using so much steroid at the initial stages of lupus nephritis with some alternative treatment regimes. And I just wanted to get a plug in for the Rituximab loop study, which is going to test using mycophenolate in a treatment called rituximab, but much less steroid than we would traditionally use. And I know that both our unit and Caroline at City Hospital are going to run this study and have it available from maybe a few months, we're not quite sure, a few months' time to start, and a few weeks, do you think? So if you're unfortunate enough to get lupus nephritis and are interested in that sort of study, then you may try and make your way to one of our centres anyway, and you might be able to go on to that study. So anyway, controlling inflammation is obviously the key thing, but there are other things that we need to do specifically because this is lupus that's affecting your kidneys. So it's very important that we reduce the amount of protein in your urine. So partly controlling the inflammation will do that, but we know that people who have scarring in their kidneys, we often can't get the level of protein down particularly low just by controlling the inflammation. We can obviously address problems like fluid retention by using diuretics. We think it's incredibly important that your blood pressure is well controlled, and it needs to be controlled much more tightly than you might let pass in someone who didn't have kidney disease. We really need to get on top of the blood pressure, because high blood pressure increases your risk of disease progression. And we also need to think about some of the other risk factors that might stress your kidneys that aren't related to the lupus and we wouldn't normally worry about, but since you've got a kidney disease, we do worry about it. So we're keen on controlling things like high cholesterol levels. So you may end up with lupus nephritis, being on 4 or 5, 6 different sorts of tablets all at once to try and improve the situation in your kidneys, and that, unfortunately, we think is the best way to manage things as it is at the moment. So just finally, I'll talk a little bit about chronic kidney disease. So rapid and adequate treatment of nephritis normally leads to a resolution of the inflammation and your kidneys aren't damaged. But unfortunately, there are some people where the nephritis just keeps on coming back, or it's hard to control. or for one reason or another there's a sort of delay to the diagnosis and it's missed and a little bit of damage is done. So damage to the kidney, which affects how it works, is called chronic kidney disease. And I think it's important to remember that your kidney can take a huge amount of damage before it has any consequences to you. So if you choose to be an organ donor and donate your kidney to one of your relatives, you can, whatever the expression is, at the cut of the surgeon's knife, reduce your kidney function by half because you take out one kidney and you're still fine. It doesn't really have any consequences at all. So your kidney can take a huge amount of damage. But at the point where your kidney function gets to about 20%, something a bit different seems to happen. It seems that a lot of people's risk of kidney function getting worse and worse. It sort of happens spontaneously or for reasons that we don't really understand. And at that stage it becomes very, very difficult to stop people's kidneys deteriorating to the point where they're not capable of sort of supporting your life, and that is called end-stage kidney disease, and that's when you need to go on to dialysis. And normally the kidney function of about sort of 7–8% is when that happens. This is rare. I think that's the important thing to say. It's rare for lupus nephritis to cause end-stage kidney disease, and most people that we see with lupus nephritis who do go on to end-stage kidney disease have lots of other problems as well that sort of contribute to how their kidney has deteriorated. So my final messages here are really, I can't emphasise enough that regular checks of your urine is essential. I think if you've had lupus for only 1 or 2 years and you have generally sort of active disease and your blood tests look active, you can't over-check your urine. 3 monthly will be a bare minimum for me. You shouldn't ignore positive urine results, and we would be keen to encourage your rheumatologist or whoever is looking after you not to try and modify your treatment too much without suggesting the possibility of a renal biopsy to actually make a firm diagnosis so that we know what we're doing. If you turn out to have lupus nephritis, I think it's important that your doctor the doctor that looks after you is capable of looking after all these other aspects of kidney health, in particular your blood pressure. And I think the final message, so I don't sort of spread too much anxiety, is that it's exceptionally rare in modern medicine for lupus nephritis to cause renal failure or to cause you to require dialysis or a transplant. But the reason that that's now rare is because we're aware of the importance of this careful and persistent monitoring and early treatment of kidney disease when you detect it.